Hi, I'm Dr. Bhargav Rao from Pathofast Lab in Pune. Maybe you went in for a thyroid blood test report and you find that one of the values in the report, which is the value of TSH or thyroid stimulating hormone, is higher than normal. Or maybe your doctor told you that you have a high TSH level and you want to know whether the symptoms that you have correlate with this level or not. You may be curious about what are the different symptoms of a high TSH level, and today I'm going to tell you everything about that in this video. TSH is a hormone that comes from your pituitary gland and it stimulates your thyroid gland, which is located here in front of your neck, to make the thyroid hormones. The TSH is in effect like the accelerator that controls your thyroid gland. If the TSH levels are very high, it means that your body is trying to stimulate your thyroid to work harder because it's not working enough. And if your TSH levels are very low, it means that your body is trying to slow down the thyroid. The symptoms of high TSH are usually the ones that we see when someone's thyroid is not working properly. And this is easy to understand. If your thyroid doesn't work properly, your body tries to stimulate it to actually work better. And the only way your body knows to do this is by raising the level of the TSH hormone. That is why when your TSH levels are high, it actually means that your thyroid is not working as much as it should. It's underworking and it's underperforming, and so all the symptoms related to a high TSH always correlate with those of a poorly functioning thyroid. The normal range of a TSH level is somewhere between 0.4 to 4, and TSH above 4.5 usually means that there is some amount of thyroid disease. Some doctors will say that a TSH value even up to 10 may not even need to be treated, but you will begin to experience symptoms even when your value is around 5. I'm going to tell you about the different groups of symptoms that you're going to see in the subsequent slides in this video. So first we'll come to the skin and hair changes, because these are very common when your TSH level goes up. Dry, rough, pale skin occurs in almost 80% of the patients, and dry skin is a very common sign. Second is hair loss, especially you might even lose your eyebrows in the outer thirds. And the third and a very common sign is brittle nails, where your nails will break easily, and you may also have a puffy face or swelling of the face in the morning because fluid builds up inside your body. The next other group of symptoms which are related to your stomach. Constipation is a very common sign that we see in people with high TSH levels. You're not able to pass motions properly, or your motions are very hard. The next is an unexplained increase in weight. You tend to gain weight. You may even gain up to 5 to 10 pounds very fast if your thyroid problem is recent, and a rapid gain of weight is very commonly seen. Difficulty losing weight is even more common. You can't lose weight because your body's metabolism has slowed down and it doesn't burn fat. This is one of the commonest signs of an increased TSH level. The next other group of symptoms which are related to your stomach. Constipation is a very common sign that we see in people with high TSH levels. You're not able to pass. Other signs of a high TSH level or a poorly functioning thyroid are very weak muscles and joint pains, which even affect your daily activities. You may have, if you're a woman, heavy and irregular periods and a difficulty in getting pregnant. This tends to affect fertility a lot. And lastly, you might feel very cold even when everyone else is complaining that the temperature in the room is too high. This is called heat intolerance, this is called cold intolerance, and it happens because the body's metabolic rate is low, and so you tend to suffer more from even a slight drop in the temperature. Other signs of a high TSH level or a poorly functioning thyroid are very weak muscles